Background music fades in. Hello, moms-to-be and future parents. Welcome back to the mom world. Today we're diving deep into a topic that confuses many women. Can you have your period during pregnancy? This is a question that brings a lot of fear, curiosity, and even misinformation. If you or someone you know is pregnant and experiencing bleeding, you might be wondering, is this normal? Am I still having periods? Is my baby safe? Don't worry. By the end of this video, you will have clear answers about bleeding during pregnancy, what's normal, what's not, and when you should see a doctor. So let's begin. First things first, let's answer the big question. Can you get your period while pregnant? The simple answer is no. Here's why. A period happens when your body sheds the uterine lining because there is no fertilized egg. But if you're pregnant, your body needs this lining to nourish the baby. That means a true menstrual period cannot happen during pregnancy. However, some women do experience bleeding that looks like a period. This can be caused by various reasons, which we will discuss in a moment. Now, if you are bleeding while pregnant, what could be causing it? Let's break it down trimester by trimester. 1. First trimester bleeding, 0-12 weeks. Implantation bleeding. Some women experience light spotting around the time their period was due. This is called implantation bleeding and happens when the fertilized egg attaches to the uterus lining. It's usually light pink or brown and lasts a day or two. Hormonal changes. Your body goes through a surge of hormones during early pregnancy. Sometimes this can cause light spotting. Cervical changes. Pregnancy increases blood flow to your cervix. This means that after sex or a pelvic exam, you might see some spotting, which is usually harmless. Miscarriage or ectopic pregnancy. Sadly, bleeding can also signal something serious like a miscarriage or an ectopic pregnancy. If you have heavy bleeding, cramps, or severe pain, seek medical help immediately. 1. Second trimester bleeding, 13-26 weeks. Bleeding in the second trimester is less common but can still happen. Some possible reasons include placenta previa. This happens when the placenta covers the cervix. It can cause painless bleeding and needs medical attention. Infections, urinary tract infections, UTIs, or vaginal infections can also cause light bleeding. Cervical polyps, non-cancerous growths on the cervix can sometimes bleed during pregnancy. 1. Third trimester bleeding, 27-40 weeks. Bleeding in late pregnancy can be a sign of labor or a medical emergency. Here are some possibilities. Bloody show. As labor approaches, your cervix starts to thin and open, releasing a mucus plug with blood. Placental abruption. This is when the placenta separates from the uterus before birth, which can be dangerous for both mom and baby. Preterm labor. If you experience bleeding with contractions before 37 weeks, contact your doctor immediately. Since bleeding can be confusing, here's a simple comparison between periods and pregnancy bleeding. If you're unsure, always check with your doctor. Although some bleeding can be harmless, certain situations require immediate medical attention. Call your doctor if you experience heavy bleeding, soaking more than 1 pad per hour, severe abdominal pain or cramping dizziness, fainting or weakness, blood clots or tissue passing, foul-smelling discharge. Don't hesitate to seek help if you feel something is wrong. Your health and your baby's well-being matter the most. Now let's bust some common myths. Myth 1. If you bleed, you're not pregnant. False. Many women experience light bleeding in early pregnancy. Myth 2. Periods during pregnancy mean a healthy pregnancy. Wrong. Any bleeding should be checked by a doctor. Myth 3. You can't get pregnant if you bleed during pregnancy. Not true. Fertility can return soon after delivery, even if you experience postpartum bleeding. To reduce the risk of complications, follow these tips. Stay hydrated. Get regular prenatal checkups. Avoid smoking and alcohol. Eat a balanced diet. Listen to your body and rest when needed. Pregnancy is a beautiful journey, and taking care of yourself is the best gift you can give your baby. Conclusion. Alright moms, I hope this video helped clear your doubts about bleeding during pregnancy. If you found this information useful, give this video a thumbs up, share it with other moms-to-be, and don't forget to subscribe to the Mom World for more pregnancy and motherhood tips. See you in the next video. Stay healthy and take care.